Have you ever known someone who's had OCD that worsened for some unexplained reason? I had a patient like this that I'd like to discuss. This is part of a common sense Lyme disease series where I take what I've learned from my practice of 37 years and share some of my thoughts. In this case, the patient had a history of OCD. A lot of people have some level of OCD. Even medical students have some OCD. But in this case, it was not very well managed. He was diagnosed with Lyme disease in the past. He was chronically sick with Lyme disease, but no one mentioned that there's a possibility that post-treatment Lyme disease syndrome can be from a persistent infection. He was fixated on his illness and his mental health declined. His OCD was not managed very well. He was having tremendous problems with school, with social life, and his family. He had been to multiple specialists looking for other diagnoses. One doctor suggested that he be looked at for a persistent tick-borne infection. He was treated for that persistent infection, which included treatment for babesia. And not only did his OCD improve, but his fatigue, pain, and brain fog lessened. His OCD was now much better controlled, and he was able to function with his family. So the takeaway is that OCD that's not very well managed is possibly related to Lyme disease, so it's worth a look-see. Also, if someone's diagnosed with post-treatment Lyme disease syndrome, it's worth looking at whether there's a persistent infection. I found this patient got better. I thought I'd share with you what happens in practice. This is part of a common sense Lyme disease series based on my practice. And let me know in the comments below if you have any questions or comments, and I'll do the best I can to answer them.